Thank you, Madam Speaker. First of all, of course, as a physician legislator, I'm particularly pleased to be able to speak to this very important bill in which we empower our Chief Medical Officer of Health, who joins us today, in order to better synchronize our messaging across the province of Ontario. Some of my honourable colleagues mentioned Fukushima, and I think those of us in the medical and biological communities can perhaps, as the member suggests, use that as an example where we need to have very much a coordinated messaging. I mean, just as a quick case in point, the Japanese government has just announced, as I think as of yesterday, that something on the order of about 3 million gallons of low radioactive water has been released directly into the Pacific, and likely more pending. There's going to be likely a slow but steady burn on the ecological front. Some of the spent fuel rods, atomic fission continues. I mean, these are very important issues. Something on the order of about 50 to 100,000 people have been displaced. Many more are homeless and unable to actually return to areas. Now, that is very much, as you've said, sir, a public health emergency that needs a coordinated response. Now, we certainly hope and pray that no such calamity befalls the province of Ontario. But should something on that order ever happen, whether it's infectious or nuclear or a chemical spill or all the various things that we treat our environment to, that is precisely the point where we need to have effective, coordinated, synchronized best practices diffused on an instantaneous basis. And of course, in the age of Twitter and Facebook and electronic communication, I think we really need to make use of all our emergency management services. Thank you, Speaker.